Okay, you've really given us a challenge this
Yeah.
time with these materials.
Hmm.
But they're so interesting.
Absolutely.
All about the cardiovascular system and all sorts of cardiac conditions.
Definitely a lot to unpack.
We've got a super detailed PDF document
Lots of nitty-gritty in there.
and then a full audio recording of a lecture.
A different angle on things.
So our goal is to sort of like synthesize all of that.
Yeah, pull out the key takeaways for you.
Yeah, so you come away with a solid understanding of this stuff
Without getting totally bogged down.
without feeling like you're drowning in medical jargon.
Exactly. We're aiming for clarity,
Yeah.
distilling it down to the most potent form.
Now, as we went through all this material,
Yeah.
it really struck me that the information kind of unfolds like a story.
Interesting how so.
It seems to start with something very common like high blood pressure,
Oh, okay.
which many people have,
Right.
and then potentially leads us through a whole series of more complex conditions.
That makes sense. There's definitely a progression there.
Yeah, so why don't we start with the absolute basics?
Sure.
The cardiovascular system itself.
Right.
What is its main job?
Well, think of it like this. It's your body's superhighway and delivery network all rolled into one.
Wow, that's a good analogy.
Yeah, its primary role is to deliver everything your cells need to function.
Like
Oxygen, nutrients,
yes,
hormones.
that good stuff.
Exactly. And at the same time, it's also acting as a cleanup crew,
Okay,
picking up those waste products like carbon dioxide so they can be removed from your body.
so it's a two-way system.
Absolutely a constant flow in and out.
That's pretty amazing.
It really is a remarkable system.
So then who are the key players in this network?
Okay, well,
Who's doing the delivering and the cleaning?
Right. So the main components are the heart,
Of course.
which is the powerful pump driving the entire system.
Mm-hmm.
Then we have the blood vessels.
Okay.
That's your network of roads, so to speak. And within the blood vessels, we have the arteries, which carry the blood away from the heart.
Okay.
Then you have the veins, which bring the blood back to the heart.
All right.
And then the tiny capillaries.
I've heard of those.
Yeah. These are where the actual exchange of oxygen, nutrients, and waste happens.
Oh, wow. So it's all happening at the capillary level.
Exactly. It's like the loading dock where everything gets delivered and picked up.
That's fascinating.
Yeah. And then, of course, we can't forget the blood itself.
Right. The actual stuff that's moving through the system.
Exactly. And it's not just a simple fluid. It's complex.
So what's in blood then?
Well, you have your red blood cells
Mm-hmm.
packed with hemoglobin, which carries the oxygen.
Oh, yeah.
Then there are the white blood cells.
Oh, right. The immune system.
Yeah, those are your defense force fighting off infections and invaders.
Okay.
Then you have plasma, which is the liquid part of blood.
Mm-hmm.
It's the medium that all the cells and nutrients travel in.
Okay.
And lastly, we have platelets. Yeah, those are crucial for blood clotting.
Oh, right. So we don't bleed out if we get a cut.
Exactly. They're like the first responders forming a plug to stop bleeding.
That's a pretty complex mixture.
It is, and it's all perfectly designed to work together.
Now, I noticed in the materials
Mm-hmm.
that they mentioned these different circuits within the cardiovascular system.
Right.
What are those all about?
Oh, absolutely. Those are key to understanding how it all works.
Okay.
So there are three main routes that the
Mhm.
blood takes through your body.
Okay.
First, we have the pulmonary circuit.
Pulmonary.
Yeah, think of this like a short trip from the heart to the lungs.
Okay, so like a little loop.
Yeah, exactly.
Ah.
It's the local oxygen station.
Okay.
So deoxygenated blood,
Mm-hmm.
it goes from the heart to the lungs to drop off the carbon dioxide
Okay.
and pick up fresh oxygen.
Like a trade.
Yeah, exactly. And then that nice oxygenated blood comes right back to the heart.
Okay, that makes sense.
Now, the second route is the systemic circuit.
Systemic.
Yeah, this one's the big one.
Oh, okay.
This is the main delivery network.
So like the interstate highway.
Exactly.
Ah.
Oxygenated blood gets pumped out from the heart
Mm-hmm.
to all the tissues and organs in the body,
No way.
delivering all those nutrients and hormones.
Mm.
And as it does this, it picks up waste products,
Okay.
becomes deoxygenated, and then returns back to the heart.
So it's like a round trip.
Yeah, a big loop all around the body.
That's pretty amazing.
Yeah. And then finally, we have the coronary circuit.
Coronary, that sounds familiar.
Yeah, coronary refers specifically to the heart's own blood supply.
Oh, right. Because the heart is a muscle too.
Exactly. And just like any other muscle, it needs its own dedicated network of arteries
Okay.
to bring it oxygen and nutrients.
So it can keep on pumping.
Precisely deoxygenated blood from the heart muscle then drains back into the heart to be sent off to the lungs for reoxygenation.
So even the heart has its own little circulatory system.
It does a mini circuit within the larger system.
That's so cool.
The body is full of these intricate systems.
Yeah. So it seems logical then that if something goes wrong in one of these circuits, it could lead to specific kinds of problems.
Absolutely. That's a really important point.
So give me an example.
Okay, well, for instance, if there's a blockage or backup in the pulmonary circuit, it can lead to fluid accumulating in the lungs.
Oh, that doesn't sound good.
No, it's not. It's called pulmonary edema.
Pulmonary edema.
Yeah, and issues in the systemic circuit can manifest as hypertension.
High blood pressure.
Exactly, which we'll talk more about in a bit.
Okay.
And then, as you might expect, problems in the coronary circuit, like a blockage, can lead to angina.
Angina.
Yeah, which is chest pain due to a lack of oxygen getting to the heart muscle.
Oh, wow, that's scary.
It can be. And if the blockage is severe enough, it can cause a myocardial infarction.
What's that?
A heart attack.
Oh, no.
Yeah, that's where part of the heart muscle is actually damaged.
Because it's not getting enough blood.
Exactly, a serious situation.
So keeping those circuits clear is pretty vital?
Absolutely. They're the lifeline for all your organs.
Okay, so the heart is the central pump of all this. Can we get a quick tour of how it's all set up?
Sure, let's walk through the heart's chambers
Okay.
and see how the blood actually flows through them.
Awesome.
So let's start with the blood that's come back from the body.
Okay.
Now deoxygenated, and it enters the right atrium.
Right atrium.
Yeah, that's the upper right chamber of the heart.
Okay.
And it enters through two major veins.
Okay.
The superior vena cava,
Superior.
bringing blood from the upper body,
Okay.
and the inferior vena cava carrying blood from the lower body.
Inferior. Okay, so upper and lower,
Exactly.
all that blood coming back.
Yeah, and from the right atrium,
Mm-hmm.
the blood flows through the tricuspid valve.
Tricuspid valve.
Yeah, it's like a one-way door
Okay.
into the right ventricle, the lower right chamber.
Right.
And when the right ventricle contracts, it pushes that deoxygenated blood through the pulmonary valve.
Another valve.
Yeah, and into the pulmonary artery.
Pulmonary artery.
Yeah, and that's the one that heads off to the lungs.
Okay, so it's going back to get oxygenated.
Exactly. Now, here's a little quirk to remember.
Okay.
The pulmonary artery is the only artery in the body that carries deoxygenated blood.
Oh, that's interesting.
Yeah, usually arteries carry the oxygen-rich blood, but not this one.
So it's an exception.
Exactly, an important one to remember.
Okay, so once it reaches the lungs.
Well, in the lungs, the blood releases carbon dioxide and picks up a fresh supply of oxygen.
Okay.
Now, oxygenated, it travels back to the heart,
Okay.
specifically to the left atrium.
Left atrium.
Yeah, that's the upper left chamber, and it travels back via the pulmonary veins.
Pulmonary vein.
And here's another exception.
Okay.
Pulmonary veins are the only veins in the body that carry oxygenated blood.
Wow, so it's the opposite of the pulmonary artery.
Exactly, a mirror image.
Got it.
So from the left atrium, this oxygen-rich blood flows through the mitral valve.
Mitral valve.
Yeah, into the left ventricle,
Okay.
which is the lower left chamber.
Left ventricle.
Yeah, and this chamber is the heart's powerhouse
Oh, wow. Why is that?
because it's the most muscular chamber, because it has to pump the blood out to the entire body.
Oh, so it has the hardest job.
It does. It's a tough job.
So it's like the main pump.
Exactly.
Wow.
So when the left ventricle contracts, it forces that oxygenated blood through the aortic valve.
Aortic valve?
Yep, and into the aorta.
Aorta.
Yeah, that's the largest artery in the body.
Okay.
And then the aorta distributes the blood throughout the entire systemic circulation.
Wow, so it's like a branching system.
It is from the aorta, it branches out into smaller and smaller arteries.
Reaching every part of the body.
Exactly. A truly remarkable network.
Okay, so that's a really clear picture of the blood flow.
Good, I'm glad.
But now the materials mention this typical progression of cardiac conditions.
Right.
Can you walk us through that sequence?
Sure. The lecture recording highlighted this common pathway, and it often starts with untreated high blood pressure.
Oh, hypertension.
Exactly.
Right.
And over time,
Mm-hmm.
that increased stress on the heart and blood vessels.
From the high blood pressure.
Yeah, it can lead to something called angina pectoris.
Angina.
Yeah, and that's when the heart muscle isn't getting enough oxygen.
Oh, no.
Yeah, typically because the coronary arteries have become narrowed.
Okay.
And if the issues causing angina aren't addressed, it can progress to a myocardial infarction,
Myocardial infarction.
which is basically a heart attack.
Oh, gosh.
Yeah, where part of the heart muscle suffers permanent damage.
Because it's not getting enough blood.
A lack of blood flow.
It's like a chain reaction.
It is. And if these earlier conditions remain unmanaged,
For a long time.
yeah, for a long time, the heart can become weakened
Okay.
and less efficient at pumping blood.
Oh, no.
Yeah, and that can lead to congestive heart failure.
Congestive heart failure.
Mm-hmm.
So high blood pressure really seems to be a critical starting point
It often is.
in this whole potential progression.
Yeah, it's a major risk factor for a lot of these conditions.
Okay, let's dive deeper into that.
Sure.
What exactly is high blood pressure?
Well, high blood pressure or hypertension, it's basically an increased resistance to the flow of blood in your arteries.
Arteries.
Yeah, remember, those are the vessels that carry blood away from the heart.
Right, right.
And this increased resistance is often due to those arteries becoming narrower.
Oh, so it's like trying to squeeze a lot of water through a small pipe.
That's a great analogy. You need more pressure to get the same amount of flow through.
Makes sense.
And over the long term, this sustained high pressure can really damage your blood vessels.
And what does that damage lead to?
Well, it can damage vital organs too,
Like
your brain, your heart, your eyes, your kidneys.
oh, wow.
Yeah, it significantly increases the risk of some serious health problems.
And it's often called a silent killer.
Right? Exactly. That's why it's so dangerous.
Because people might not even know they have it in the early stages.
Hypertension usually develops gradually over many years. And often people don't experience any noticeable symptoms initially.
So their body's just masking the problem.
Yeah, the body can compensate for a while.
Wow.
But even without symptoms, that elevated blood pressure is still silently causing damage.
To the blood vessels and organs.
Exactly. That's why regular blood pressure checks are so important.
So you can catch it early.
Yes, early detection is key.
Now, the PDF outlined all these different categories for blood pressure readings.
Right.
Can you explain what those numbers mean?
Sure. So blood pressure is measured using two numbers,
Okay.
systolic pressure and diastolic pressure.
Okay, I've heard those terms, but I don't really know the difference.
So systolic pressure
Mm-hmm.
is the pressure in your arteries when your heart beats,
When it's pumping.
exactly when it's contracting and pumping out blood.
Okay.
And then diastolic pressure is the pressure when your heart is resting between beats.
So like the lower number,
Yeah, exactly. And both of those are measured in millimeters of mercury,
millimeters of mercury.
or MHg for short.
Okay, got it.
So generally, a healthy blood pressure is considered to be less than 120 systolic
Okay.
and less than 80 diastolic.
So that's the 120 over 80 that we always hear about.
Exactly. That's the ideal target.
20 over 80.
Yeah. And if the systolic reading is between 120 and 129,
Okay.
but the diastolic is still less than 80, that's what we call elevated blood pressure.
So not quite hypertension yet.
Right. It's a warning sign that you might be headed in that direction.
Okay.
Then we have stage 1 hypertension.
Stage 1.
Yeah, that's when the systolic pressure is consistently between 130 and 139.
Okay.
Or the diastolic pressure is between 80 and 89.
So either one of those numbers being high is enough?
Exactly. Either one puts you in stage 1.
Okay, then what about stage 2?
Stage 2 hypertension is when the systolic is consistently 140 or higher,
Okay.
or the diastolic is 90 or higher.
So those are getting pretty high.
Yeah, that's more serious.
And then there's hypertensive crisis.
Right, that's when things get really dangerous.
How high are we talking?
That's when the systolic shoots above 180.
180.
Yeah, or the diastolic is over 120.
Wow, that's a huge difference.
Yeah, that's a medical emergency.
Oh, wow.
If someone has symptoms like chest pain, severe headache, shortness of breath, along with those very high readings, they need to seek immediate medical attention.
That's really serious.
It can be life-threatening.
So it's important to monitor your blood pressure.
Absolutely. Regular checks are essential.
Okay, so if lifestyle changes alone aren't enough to manage high blood pressure,
Right.
medication might be necessary.
It often is.
And the PDF listed 6 main categories of hypertension medications.
Yeah, there are a lot of different options.
And they work in different ways.
They target different mechanisms.
Okay, so let's start with diuretics.
Okay, diuretics.
What's their role?
So diuretics are often a first-line treatment for hypertension. And their main job is to help your body get rid of excess fluid and salt.
Through urination.
Exactly. They make you pee more.
Okay.
And by reducing that overall amount of fluid in your bloodstream, they lessen the workload on your heart.
Okay.
And that helps to lower your blood pressure.
So it's like reducing the volume of water that the pump has to push.
That's a good way to think about it.
Okay.
Less volume, less pressure.
And I noticed in the PDF there were different kinds of diuretics.
Right. There are several types.
And they're classified by where in the kidney they work.
Yeah. So diuretics target different parts of the nephron.
Nephron.
Yeah, that's the functional unit of the kidney.
Okay.
It's where urine is formed.
Right.
So one type is called acetazolamide.
Acetazolamide.
Yeah. And it works in the proximal tubule
Okay.
by inhibiting an enzyme called carbonic anhydrase.
Carbonic anhydrase.
Yep, it's a mouthful.
It is.
But basically, it's used not just for fluid overload, but also for conditions like some types of epilepsy and glaucoma.
Wow, so it has multiple uses.
It does.
Interesting.
Then there's mannitol.
Mannitol.
Yeah, it's an osmotic diuretic.
Osmotic.
Yeah, it works a bit differently.
Okay.
It works in the descending limb of the loop of Henle.
Loop of Henle, what's that?
Oh, it's just the specific part of the nephron.
Oh, okay.
Don't worry too much about the names.
Okay.
But the point is it helps increase urine production.
Okay.
And it's used to reduce swelling in the brain.
In the brain.
Yeah, like for cerebral edema.
Oh.
And it's also used to treat glaucoma
Okay.
and can help flush out toxins from the body.
So it's a heavy hitter.
Yeah, it's got a lot of uses.
Then there are loop diuretics.
Right, loop diuretics.
They're like furosemide.
Exactly. Furosemide is a common one.
Okay.
And those are very powerful.
Powerful.
Yeah. They act in the ascending limb of the loop of Henle.
Again with the loop of Henle.
Yeah. Don't worry about the specifics.
Okay.
The key is they block the reabsorption of sodium, potassium, and chloride.
So those electrolytes get flushed out?
Exactly. And they're used for significant fluid retention.
Yeah.
Like in heart failure, liver disease, kidney problems.
Wow, so lots of serious conditions.
Yeah. And they can be used for hypertension, too.
Okay.
Now, another type is thiazide diuretics.
Thiazide.
Yeah, like chlorthalidone.
Phenylalone.
Yep. That's a commonly used one.
Okay.
And those work in the distal convoluted tubule.
Distal convoluted tubule.
Yeah, another part of the nephron.
Okay.
But they block the reabsorption of sodium and chloride there.
Okay, so similar to loop diuretics.
Similar, but not as powerful.
Okay.
And they're often a first choice for treating uncomplicated hypertension.
So for milder cases.
Yeah, and they can help with mild fluid retention, too.
Okay.
And lastly, we have potassium-sparing diuretics.
Potassium sparing.
Yeah, these are interesting.
Why are they potassium sparing?
Well, they work in the collecting duct of the nephron.
Okay.
And they block the action of a hormone called aldosterone.
Aldosterone.
Yeah, it's a key hormone in regulating salt and water balance. So by blocking aldosterone, these diuretics cause the body to get rid of sodium and water,
Okay.
but they hold on to potassium.
Oh, so they spare potassium.
Exactly.
Yeah.
And they're used for hypertension, fluid retention, and heart failure.
Okay.
And one specific one, spironolactone.
Spironolactone.
Yeah, it actually has some hormonal effects, too.
Really?
Yeah, so it's used off-label for things like excessive hair growth in women.
Wow, that's interesting.
Yeah, and some types of acne and hair loss.
So it's a multitasker.
It is. It's quite versatile.
Okay, so that's a good overview of diuretics.
Good. I'm glad.
Now, the next category is adrenergic antagonists,
Right.
and that includes beta blockers.
Yeah, beta blockers are a big one.
So how do they help with high blood pressure?
Well, beta blockers primarily work by counteracting the effects of adrenaline and noradrenaline.
Adrenaline.
Yeah, your fight or flight hormones.
Okay.
And they do this on the heart specifically.
Why?
They block beta adrenergic receptors.
Beta adrenergic receptors.
Yeah, these are like little docking stations for those hormones.
Okay.
So by blocking them, the beta blockers lead to a slower heart rate
Okay.
and a less forceful contraction of the heart muscle.
So heart's just chilling out a bit.
Exactly.
Oh.
And this, in turn, reduces the amount of blood the heart pumps out per minute.
Because it's like turning down the flow.
Yeah, and that's called cardiac output.
Cardiac output.
Yep, and by lowering cardiac output, you lower blood pressure.
Okay, that makes sense.
And by making the heart work less hard, they also reduce its need for oxygen.
Oh, okay.
So that's why they're helpful in treating angina, too.
Right, because angina is that chest pain?
Yeah, from the heart not getting enough oxygen.
Got it.
Now, what's interesting about beta blockers is they not only lower blood pressure by acting on the heart,
Okay.
but they also highlight how interconnected the body's systems are.
How so?
Because their action on beta-2 receptors,
Take it too.
yeah, those are found in the lungs and blood vessels. So that can have implications for respiratory health.
Oh, so you have to be careful with those.
Yeah, you have to use them judiciously.
The PDF listed a few specific beta blockers, like propranolol.
Right, propranolol.
What are some important things to know about that one?
Well, propranolol is a non-selective beta blocker.
Non-selective.
Yeah, meaning it blocks both beta-1 receptors, mainly in the heart,
Okay.
and beta-2 receptors.
Oh.
Those are found in the lungs and blood vessels.
Right.
So by blocking beta-1 receptors, it does a good job of lowering heart rate and blood pressure.
Okay.
But blocking beta-2 receptors in the lungs can cause the airways to narrow.
Oh, that's not good.
No. So propranolol is generally not used in people with asthma or COPD.
Makes sense.
And suddenly stopping beta blockers like propranolol can sometimes lead to heart rhythm problems.
Oh, wow.
So you have to taper off gradually.
Got it.
Common side effects can include tiredness and dizziness,
Okay.
and it also interacts with other medications.
Oh, how so?
Well, some drugs can increase its effects, and others can decrease them.
So you have to be careful about drug interactions.
Yeah, your doctor will manage that.
Now, what about prazosin?
Prazosin.
It's another adrenergic antagonist that's listed.
Mm-hmm.
It sounds like it works differently.
It does. It's a selective alpha-1 adrenergic antagonist.
Alpha-1?
Yeah.
Okay.
So instead of working primarily on the heart, like beta blockers,
Mm-hmm.
it mainly works by relaxing the smooth muscles in your arteries,
Okay.
which widens the blood vessels.
So it's directly targeting the blood vessels.
Exactly, and that lowers blood pressure.
Okay.
And a key benefit of prazosin is that it doesn't tend to affect the lungs.
Oh, so that's good for people with breathing problems.
Yeah, it can be a safer option for people with asthma or COPD.
Who also have high blood pressure?
Exactly.
And then there are other beta blockers mentioned like nadolol,
Yep, nadolol,
andolol,
voiceprolol,
ispetalol,
isobutyl,
carvedilol,
carvedilol,
and labetalol.
ligadolol.
Are there any key differences between those?
Yeah, so nadolol is another non-selective beta blocker.
Okay, so similar to propranolol.
Yeah, similar actions.
Okay.
Now, esputalol is a bit different.
Okay, how so?
It's a selective beta-1 blocker.
Selective beta-1.
Yeah, meaning it mostly targets the heart
Okay.
and has less effect on the lungs.
Oh, so potentially better for people with breathing issues.
Potentially, yeah, it's often better tolerated.
Like,
And it's used for hypertension and certain irregular heartbeats.
okay.
Now, carvedilol and labetalol,
Yeah.
those are interesting.
Why?
Because they block both beta and alpha-1 receptors.
So they have double action?
Exactly. It's like a 2-for-1.
Wow.
And this dual action leads to more significant widening of blood vessels,
Okay.
which can be particularly useful when high blood pressure is accompanied by increased resistance in the peripheral arteries.
So for more severe cases?
Yeah, it can be helpful.
Okay.
Now, labetalol is often used in situations where blood pressure needs to be lowered quickly.
Oh, really?
Yeah, like in pregnancy-induced hypertension or hypertensive emergencies.
So it's like the emergency beta blocker?
You could think of it that way. And carvedilol has also shown benefits in people with stable chronic heart failure.
Okay, so it has multiple uses too.
It does.
Now, you mentioned alpha-1 receptors.
Yeah.
What's a potential side effect of blocking those?
Well, blocking alpha-1 receptors can cause a drop in blood pressure when standing up.
Oh, it doesn't sound good.
Yeah, it can lead to dizziness or even fainting.
And that's called
Orthostatic hypotension.
orthostatic hypotension.
Yeah.
Okay.
Yeah.
So moving on, the next category is calcium channel blockers.
Right, calcium channel blockers.
How do those work to lower blood pressure?
So calcium channel blockers work by preventing calcium from entering the muscle cells in your blood vessels and heart.
So calcium is important for those muscles.
Calcium is needed for those muscles to contract.
Okay.
So by blocking calcium entry,
Mm-hmm.
these drugs cause the blood vessels to relax and widen,
Oh, okay.
and that reduces the resistance to blood flow and lowers blood pressure.
So it's another way of widening those vessels.
Exactly.
And what about the heart?
Well, in the heart,
Mm-hmm.
they can also weaken the force of contraction
Okay.
and slow down the heart rate.
Oh, so kind of similar to beta blockers in a way.
Yeah, there's some overlap in their effects.
Okay.
But calcium channel blockers can further contribute to lowering blood pressure,
Okay.
and they can be helpful in managing angina and certain heart rhythm problems.
So they have multiple uses as well.
We do. They're quite versatile.
The PDF mentioned dihydropyridine and non-dihydropyridine calcium channel blockers,
Right. Those are the two main categories.
giving nifedipine, verapamil, and diltiazem as examples.
Yep.
What's the main distinction between those types?
So dihydropyridine calcium channel blockers,
Like nifedipine.
exactly like nifedipine.
Okay.
They're generally more effective at widening blood vessels throughout the body,
Okay.
and they're primarily used to treat high blood pressure and angina.
Okay.
Now, it's worth noting that knife dip